Hi, today I want to talk to you about a health problem called an aneurysm. You may have never heard this word before, but it is important to understand because an aneurysm can be dangerous if it isn't found early. An aneurysm happens when a blood vessel in your body becomes weak. Because of this weakness, the vessel starts to bulge or balloon out, a bit like a weak spot on a tire swelling under pressure. Aneurysms can happen anywhere, but they are most common in your brain, like cerebral aneurysm, and in the main blood vessel in your abdomen called the aorta. So why do aneurysms happen? One main reason is high blood pressure, which puts constant stress on blood vessel walls. Smoking weakens blood vessels and makes them less elastic. Some people are born with weaker blood vessel walls, so family history matters. Age also increases risk because blood vessels naturally get weaker over time. Certain diseases like connective tissue disorders or rare infections can increase the chance of aneurysms as well. The tricky thing about aneurysms is that small ones usually have no symptoms. You might live for years without knowing you have one. When symptoms do appear, they depend on where the aneurysm is. A brain aneurysm may cause a sudden severe headache, dizziness, blurred vision, or trouble speaking. An abdominal aortic aneurysm usually has no warning signs, but if it grows large, it can cause deep pain in the chest, back, or stomach. Though this is less common, these symptoms should never be ignored, as a ruptured aneurysm is a medical emergency. So who is at risk? People with high blood pressure, high cholesterol, or a family history of aneurysms are more likely to develop one. Men have a higher risk for some types of aneurysms, though women can also be affected, especially later in life. Lifestyle factors like smoking, poor diet, and lack of exercise can make blood vessels weaker over time, increasing risks. The good news is that aneurysms can often be prevented or detected early. Controlling blood pressure through regular checkups, prescribed medication, and stress management is very important. Stopping smoking protects your blood vessels. Eating healthy foods, staying active, and maintaining a healthy weight supports strong blood vessels. For people with a family history or other risk factors, doctors may recommend screening tests even if there are no symptoms. An aneurysm is a silent condition that can become serious if ignored. Understanding it, living a healthy lifestyle, and getting medical advice when something feels unusual can save lives. Small healthy choices every day make a big difference. Thanks for watching. Bye.